Hi, Don here. Welcome to Podiatry Practice Mastery. Today I'm going to talk about something called the end of treatment recap. Um, if you haven't heard about this, you may have heard about the teach and then repeat back method that we learn about in school. I find many times our patients get overwhelmed because the things that we're treating them for, such as plantar fasciitis or Achilles tendonitis, we have been treating them day in and day out for years, but it's the first time that they've come in with this condition and they become a little overwhelmed when we talk about all the treatments. And I want to confess this is an error that I've made. I kind of almost just share everything with patients, and you could almost equate it to just spewing everything on them, and then kind of leave them at that. And I think that brings a lot of overwhelm, brings a lot of confusion. It doesn't make them the most compliant because they don't know what to do. And I learned about this idea. I probably relearned it from Paul Hobro. So Paul, I am getting some coaching from for shockwave, and I did him. And this is something that's very, very vulnerable. So if you want to do this, find a good friend and actually go over with them how you would explain a common condition, how you would explain plantar fasciitis or Achilles tendonitis. Do the exact presentation that you would do for the new patient and have them critique you. And that's what Paul did. And he said my presentation was good, using the images was helpful, but where it really kind of fell apart was at the end. And I never recognized, because I don't think we'd recognize these things in our own treatment because we're so busy treating patients, we don't really know how effective we are at our treatment. And he recommended just something simple at the end, would be like the end of visit recap, and you really have to keep it to less than 3 things. And what I found works is I like to divide things into like 3 things because it's easier. So patients are going to forget about 80% of what you say. And I have one of my colleagues here, Neil, he always says, you talk to patients, talk to them, and then when they leave, when they talk to their spouse, what are they going to say? And many times they're going to say like, oh, the doctor said I was fat, or my heel pain's caused because I'm fat. And we didn't even bring up the topic of weight. They brought up that topic because that was a underlying concern for them, but that's what they remember. That's what they take away. So the question is, what are they going to repeat to their spouse, especially when we're recommending many times very expensive treatments for them that are going to cost thousands of dollars. And so with patients, what I've found with plantar fasciitis, I'll just give you an example, is I say we have to treat 3 things. We have to treat the tightness in the back of the calf. Sometimes I'll use the word equinus, but many times I won't. We'll talk about stretching, foam rolling, morning stretch. So we have to treat that. We have to treat where your foot is, the type of shoe gear, so shoes and orthotics. And then we have to treat the actual problem that you have. You can use the word pathology or the problem. And the best way to treat that is with something called shockwave therapy. And then I'll kind of explain about that. It stimulates your body to make better cells and helps it to heal itself. So doing that recap at the end makes it a lot easier for patients to know what their plan is. So what I've tried to do at the end of each visit is I say, okay, let me just recap what we talked about today. Because many times patients come in with multiple conditions. They might come in with doing a nail sample for fungus. Then they also have plantar fasciitis. Then they also have diabetes. So if it was those 3, I would say, okay, today we took a nail sample. I'll get those results back in a few weeks, and we'll go over those. For the plantar fasciitis, we have this treatment that we're going to set up. And then for the diabetes, we'll set up in the future a diabetic foot exam. I know there are certain doctors that don't do multiple conditions at once. I tend to try to get as many as I can, at least start the process for them. I might not totally treat them in each visit, but at least start the process for them. So I find this kind of end of treatment recap really helps because our patients aren't remembering it. And something that can help a little bit more is when you write this down. So I have something I call a treatment sheet that I fill out for patients and I give it to them. That can help. And then I also have a single web page or a blog. It's basically a blog page that explains each of the conditions that I'm treating. So if they have plantar fasciitis. It has a little video, and then it has an explanation. So basically, it's like a web page and everything. Because many patients, some want to know everything and they want to review that. Others don't care and they'll just take you at your word. I think the majority of people are just lazy and they just hear what you say and they will do it. But there's a few patients that want to learn more and more, and we need to do this without overwhelming the patient. So I'd invite you to try that. I'm trying it. I'm trying to kind of get better at it. And the other thing I'd recommend, and this is something I've learned because of making this mistake, many times we are busy in the office, and the key I find, especially for some of these high-priced treatments, is patients just want to get started. And so, for example, as much as possible, if you have time to do Swift, that visit, if you have time to do shockwave, that visit, if you have time to do an ultrasound, that visit, I find it's very beneficial, okay? And there's a specific other kind of a technique that I like, and I don't even know if it's called a technique. I call it the price space technique, and it probably has a better name for it, but this is what I call it. So let me give you an example. It's between when you say the price and when they have to make the decision, you want to give them some time. So once again, I learned this as well at one of the shockwave conferences I went to. Many times when people are doing physical therapists, they're doing shockwave. They're going to kind of talk about shockwave. They kind of say the price, and then they do some massage or some type of therapy for them, maybe on the back of the calf, and then they have them make the decision after that. I think if you talk about things and have them make a decision right away, they're not ready. They need some time to sit in that and kind of think about that. And so when I talk about shockwave and orthotics, many times I'm recommending them in combination. So for example, a patient comes in, I evaluate them, do the x-rays, gait evaluation, push on the heel. You know what's going on. They share their whole story. And when I do that, then I say there are a few different types of treatments we can do. Some are simpler, some are a little bit more comprehensive, and most of my patients I am recommending, initially something to reduce the inflammation, icing, anti-inflammatory, contrast baths, and then for tightness, usually night splint, foam rolling, some type of stretching routine, and then newer shoes if they don't have new shoes, and then orthotics. And then, so what I do is then I give them an option. And I say most of my patients, they don't get better with these initial things. So I used to always do the initial things and then see them back in 3 weeks and then start the other things, the shockwave and orthotics. But what I found is the amount of patients that actually get better with these initial things, with like Celebrex or meloxicam, the contrast baths, the stretching, are very few. I'm tending to see patients that have had chronic plantar fasciitis for a long time, and those don't work. So I give them the option. This is something I've learned as well, is I'm honest with them. I say, hey, a lot of times this doesn't work. I'm going to see you back in 3 weeks. This could delay your treatment for about 3 weeks. I'm okay with that. That's what I used to do, but now I'm doing a little bit different. I am just telling patients, I don't find this other stuff really works. In 3 weeks, we're going to have this next conversation. Do you want to go right to the second step? And many patients, they want to go right to the second step. They want to go to the second step with plantar fasciitis, many times with nail fungus. They don't want to do the nail sample. They just want to go right to the second step. And I'm okay with that. It's better for me, and I think it's better for the patient. So when they say that, then I say, okay, so normally at the second step, I'm setting up shockwave for patients to help get rid of the pain in your heel. And then usually once the pain starts to calm down at about the third session, that's where I am doing making you an orthotic. Okay, shockwave, the 6 sessions is $1,500. The orthotic is $600, and this is the point where I stop. Okay, where I stop, and then I say, and now we're going to do an ultrasound. So the ultrasound for me is this pause, is this gap where they can kind of think about it. And then I leave, maybe go see another patient. Staff comes in, show them the ultrasound, show them one fascia is a lot thicker, or one Achilles is thicker, or whatever I'm doing, and it's always the ultrasound that really helps the patients to understand, well, wow, my tissue is bad, there's swelling in there, it's totally different than the other side, this is why I need to do this. And they've had time to think about the price that I went over, and then they'll say, okay, I'm ready for it. Let's do this. And then this is the key point. If I have time or if I am able, I will do that treatment that day. I will, usually the ultrasound is in the shockwave room, and so I just do the shockwave for them, and then they set up the other 5 sessions, so it gets everything kind of done that same day. So I think with this, patients, when they make that decision, they don't want to delay 3 days, they don't want to delay a week, they certainly don't want to delay a couple of weeks. And to get over the question, some patients say, well, I have some vacation coming up. Some other wording I learned is like, ideally we'd like to get 6 sessions in within the next 8 weeks. So if they have something going on, if I have something going on, that's fine. We'd like to get them in the next 8 weeks. Or if they're training for like a special event, like a run or a marathon or anything that they need to recover quicker, I might speed them up. Instead of doing them once a week, I might do them every twice a week for them. So I think this is something that's very important. I didn't learn about this. No one ever taught me about this. But having patients, so just to recap, so one thing is at the end of each treatment, recap the main points with the patients. And then the second thing is, when you're talking about treatment, give them an option to kind of skip the initial things and go to the more advanced things that are really going to get them better, that will get them better. And the only reason you're not doing that is because insurance doesn't cover them. And you're tending to say, oh, let me take money from your insurance first. Not going to really work. Delaying things, and then we'll do the other things. So give them the option to do the things that will work to get them better, that will work, and then give them a space. So at the space, you could just give them time to think about it, but it's kind of an awkward thing to say, hey, I told you the price here. Why don't you think about it for a few minutes and I'll come back? That's why I like doing the ultrasound, or maybe going to get them a treatment sheet where I have it written out. You could do other things. You could get them a piece of paper that you're going to fill out. You could get them a brochure about shockwave. You could do whatever else you want to do. So hope you guys find that beneficial. If you want my resources on shockwave, where I explain all of this stuff on shockwave and on Swift, it's on Podiatry Practice Mastery. On the bottom, there are something that's called Shockwave Resources and Swift Resources. And in there, you're going to find a lot of these ideas, these scripts, and things like that I found helpful. If you have other ones that are helpful, please let me know. Shoot me an email. I'd love to hear from you. If these help you as well, let me know. Don at podiatrypracticemastery.com. Hope this is beneficial for your practice.